Hello everyone, the active effects of LSD 78 years ago. LSD is the most known and probably the most sophisticated of psychedelic compounds. Here in Kosmicare, LSD is one of the drugs that people most bring to our drug checking services. Kosmicare is a non-profit organization based in Portugal that works every day to transform drug policies and promote the empowerment of people that use drugs, as well as their families and communities. Through harm reduction principles, we share information about drugs, its effects, and help users to manage the risks. We have a drug checking service where users can submit their samples for analysis and get information on their chemical composition and advice. We work with national and European institutions on drug monitoring on new psychoactive substances. Cosmicare also provides a service of psychological intervention, where people can get help to manage the drug use or difficult experiences. My name is Daniel Martins, and I'm part of Cosmicare team and a PhD student in the medicinal chemistry group of Faculty of Science of University of Porto. To talk about LSD and psychedelic research, we have the honor to have with us Professor David Nichols, a psychedelic chemist and pharmacologist that is in the center of the psychedelic revolution of the past decades. David and his team prepared dozens of new psychoactive drugs through the years, and he has been one of the key players on the path of establishing psychedelics as medicine. David Nichols held the Robert C. and Charlotte P. Anderson Distinguished Chair in Pharmacology, and in addition was a distinguished professor of medicinal chemistry and molecular pharmacology at Purdue University College of Pharmacy. He was continually funded by the NIH for nearly 3 decades and served on numerous government review panels. His two principal research areas focus on drugs that affect serotonin and dopamine transmission in central nervous system. He began medicinal chemistry research on psychedelics in 1969 and has been internationally recognized as top expert on medicinal chemistry of psychedelics. He has published more than 300 scientific articles, book chapters, and monographs. And in 2004, he was named the Arwin 8-page lecturer by the International Society for Serotonin Research, a keynote he gave in my city, Porto, Portugal. In 1993, he founded the After Research Institute, which has supported and funded clinical research with psilocybin and led so-called renaissance in psychedelic research. Personally, having this conversation with David is an amazing opportunity. The work that Professor Nichols published through the years were central in my interest in following chemistry. Thank you, David, for joining us.
Pleasure to be here.
Lysergic acid diethylamine, or LSD, was discovered by Albert Hofmann, a Swiss chemist from the pharmaceutical company Sandoz, while researching on molecules that could be used as analgesics, compounds that are stimulants for respiratory or circulatory system. On April 16 of 1943, a Friday afternoon, while working on his lab, Hofmann felt dizzy and strange and went home where he experienced an intoxicated dreamlike state and thought that probably some of the compounds he was working on got into his body. 3 days later, on Monday, April 19, he did a self-experiment. He ingested a quarter of a milligram, 250 micrograms of LSD. 40 minutes later, he felt that he needed to go to home. He went by bicycle. That's why we call it the bicycle day. In the report of that day to the head of Sanders' department, Hoffman described a strong experience with visual disturbance, kaleidoscopic visions and fractals, abnormal thought process, and out-of-body experience. He thought he was dying. A doctor was called, and physically everything looked fine. At the end of the day, everything got back to normal. Nowadays, 250 micrograms of LSD is considered a high dose, and the report of Hoffman described a strong psychedelic experience. Early on, LSD catch the attention of psychiatrists and artists of the Beat generation. The experience that LSD evoked was at the time quite difficult to define. Was Humphrey Osmond, a Canadian psychiatrist, that proposed in a letter to the famous writer Aldous Huxley, called this type of substance psychedelics. David, how would you define a psychedelic drug?
Well, according to Osmond, it's derived from the roots meaning mind manifesting. So when I started my research in 1969, they were called psychotomimetics, which meant they mimic psychosis. And they never mimic psychosis, but that was what, actually, that's what Sandoz thought in the beginning. They gave them to anybody who wanted them to study with the idea that they would produce a model psychosis. And so a psychiatrist would take it, and after he had the effects, he would say, oh, that's what happens in the mind of my patients. But that's not what happens in the mind of patients. So then the next phase was to call them hallucinogens. And actually, in the United States and in many regulatory bodies and among the police, they're still called hallucinogens. And hallucinogen implies that they produce hallucinations. But a hallucination is something that you can't tell from reality. So normally people who take LSD, they know that it's not a normal situation. And so they're not really hallucinogens. So when we started the Hefter Institute, we wanted to find money to support clinical studies because that was a piece that was missing, because there was behavior in rats and cats and mice, but no clinical studies. And so we had a meeting. So what were we going to call ourselves? Were we going to study hallucinogens, or were we going to study psychedelics? And of course, psychedelics had been the popular term with recreational users since almost the beginning, psychedelics. And so we said, no, we're going to study psychedelics. And we had a number of powerful people who said, that's a big mistake. You're going to sound like a bunch of hippies, psychedelics and acid rock and tie-dyed clothes and stuff. And we said, but they're not hallucinogens. We're not going to study hallucinogens. They're psychedelics. They bring out things in the mind that you can't ordinarily see. So they do, the definition that was in Goodman and Gilman's Pharmacological Basis of Therapeutics in the 7th and 8th editions, which are a little bit old, but Jerome Jaffe said that their substances produce changes in thought, feeling, and perception that can be experienced otherwise only at times during times of dreaming or during religious exaltation. So if you imagine dreams and religious experiences just in the context outside drug use, that's a powerful statement about what drugs do. They produce feelings like dreams and religious exaltation. So that's kind of, in a nutshell, what a psychedelic is: mind manifesting, but producing these feelings that normally you wouldn't have outside of dreaming, or if you had some religious experience.
Perfect. The next one is a small provocation. In 2003, in the conference Mind States 4, you presented a talk named Hypothesis on the Albert Hofmann famous 1943 bicycle day, where you briefly argued that the Swiss chemists were very meticulous, maintaining very neat work habits, and hardly an experienced chemist like Hofmann could get 50 or 70 micrograms LSD into his body. You describe an experiment by the late psychedelic chemist Nick Sen, where he dissolved LSD in dimethyl sulfoxide, a solvent that is known to promote skin absorption, and painted on its skin. Sen reported that nothing happened. In the conclusion, you say, the only hypothesis I can come up with that's consistent with all these facts is that on April 16th of 1943, Albert Hofmann did not get LSD into his body at all. He had a spontaneous mystical experience. This hypothesis was very surprising to me. I have a quite materialistic views. I'm very open to spiritual experience. However, it's very difficult to me to believe that Hofmann had a premonition on the 25th compound he was preparing. More recently, in the series Dark Classics in Chemical Neuroscience, on a paper about LSD, while exploring this part of LSD history, you advance new facts. You point that in that day, Hofmann was doing a chromatographic separation of lysergic acid from the epimeric isolysergic acid diethylamide, and only later prepared the salt. Maybe the salt could not penetrate the skin, but the free base can. And another important fact that you highlight, Swiss chemists of that era, although meticulous, never used protective gloves. So my question is, are you comfortable with this explanation, or do you still consider that there is room for mystical intervention in the LSD discovery?
So that was a rather controversial hypothesis that I proposed at a meeting, a mind states meeting. And first of all, and Hoffman admits this himself, he made LSD 25 in 1938. He sent it to the pharmacology department, and they said, it increased activity in mice, but they had no further interest. Okay, so that's it. If you work in drug industry, and he mentions this, if you work in the drug industry and make a substance and you send it to the pharmacology people, they say they tested it and whatever test they had, and it was not of any further interest. You don't usually make another sample to send down and say, I think you guys screwed up something. That would be very insulting for the pharmacologists. I think especially for German pharmacologists, to say, I think you screwed something up. So that's the first point. Why did Albert Hofmann even make the substance? Why did he go back and make another sample? Because had he sent it to the pharmacology department, they would have, nothing had changed in 5 years. They still were using mouse and smooth muscle assays. So they would have said, Albert, we don't see anything useful here. They would have returned the same result. It was only the fact that he got some in his body that changed the course of history. Now, German chemists were very meticulous. And, they say that, and he was in Switzerland, right? Basel. So they make the joke about there's no such thing as obsessive compulsive disorder in Switzerland because everybody is so obsessive. I don't know. But I think he was very meticulous and very careful. And he knew that ergot alkaloids were very powerful. Now, he could not have imagined that this LSD would be that powerful because he'd made a number of ergot alkaloids for treatment of postpartum hemorrhage and migraine and things like that. But none of them had that kind of potency. So he probably was a little bit cavalier. He didn't imagine it would be that potent. He does say he purified another sample. And I believe he used column chromatography with methylene chloride. So it's possible that some of the solution could have gotten on his hand and the free base could have been absorbed through his skin. But when I gave a thought experiment when I gave that talk, and I asked the audience to keep their hands up based on, and I read the description of the effects that he had on that first accidental ingestion. And I said, how many people think that he had at least 50 micrograms in his system? And all the hands went up. There was an audience of 200 or 300. Then I said, how many think it was 100 micrograms? All the hands still stayed up. How many 150? Then a few hands dropped. How many 200? More hands dropped. 250. Almost all the hands are down. So I said, okay, this audience, which is an educated audience with respect to the effects of LSD, you seem to think that he must have accidentally ingested around 100 to 150 micrograms. So then I read the next part of the story, and he says, within 2 to 3 hours, these effects dissipated. Now, and they're all looking at each other. I said, none of you would say if you took 150 micrograms of LSD that the effects would be gone in 2 to 3 hours, right? So in order for the effects to be gone in 2 to 3 hours, how much LSD did he get in his system? Maybe 20 micrograms. I don't really know. I haven't seen the story where they say how long 20 micrograms would last. But 20 micrograms is the just barely detectable dose. 25 is more reliably detected. And so would it produce the kind of kaleidoscopic visions that he described? So there's this conundrum, how much accidentally could he get in the system? He was very careful. It's conceivable maybe he could get 20 or 25 micrograms on his skin from the solution of the free base, but not of the salt. So why did he make it? How did it get in his system? How much got in his system? And everybody at the conference was really puzzled because they never paid attention to the fact that after 2 to 3 hours, the effects wore back off. So that was another thing. Now, so then I said, and when Albert Hofmann was a young child, he had a spontaneous mystical experience. So he had a predisposition, let's say, to having a spontaneous experience. So I said, let me offer the hypothesis that he never really got it in his body on that first time. And it was a spontaneous experience. And I said, if I'm working in the lab and I start having some kind of a psychedelic experience, I'm not going to assume that it's spontaneous. I'm going to assume that it was something I was working with, which is what he did. So that was the context for that. I don't really know if I believe that, because it's a spontaneous mystical experience. Probably wouldn't. It would be a feeling of awe, a feeling one with the universe. It wouldn't be the low-level effects of kaleidoscopic visions and colorful patterns and things. So I threw that out as a kind of just an alternate hypothesis. But but I asked Albert, I said, do you have any idea? He says, I have no idea. I don't know what happened. And so, and they didn't wear protective gloves like we do now. So when I purify LSD on the column, I've always got rubber gloves on. But I can tell you that we made lots of LSD in my laboratory. In fact, the first time I made LSD, I purified it. It was a big column. It was, a 6-foot long column packed with alumina, and it was, 2 inches in diameter. So I did a lot. And I had students who made it, and we always purified it. And after you'd finish, you'd turn out the lights and take an ultraviolet light and show it around the lab. And there would be splotches of blue fluorescence everywhere. So you knew, and in those days, we weren't wearing protective gloves in the lab. That was more recent. So all the early work I did, my students did, was with bare hands. And actually some of my students told me they deliberately were very careless and got splash solution on their hand, etc. Nobody ever got high.
Yeah.
So, it's an interesting hypothesis. It's pretty weak, but it was just an attempt to say.
And Hoffman already knew that the derivatives of lysergic acid were very bioactive, so probably
he was especially careful. I think he would have been especially careful because he knew that ergots were extremely potent. Now, he didn't know none of them were as potent as LSD proved to be.
Yeah.
I think he would have been especially careful because he knew that ergot alkaloids were potent and toxic.
Yeah.
So, that adds to it. Why he went back and made it again, knowing that pharmacology department wouldn't test it. Just things kind of, and why did he have this inspiration to prepare another sample 5 years later? He
Probably
said
you are right, yeah.
He says he's eating lunch, and I think he was eating a cucumber sandwich for lunch, and he said it just struck him that pharmacology people had missed something, so he wanted to prepare another sample. So, it's any way you look at it, it's strange because he made tens of derivatives of ergot. This is LSD 25, but we know there was at least a 52, and I believe there was even an 80 something. So he may have made 80 derivatives of ergot with different substituents. And just the one, he decided they had missed something, LSD 25. So, it stands out as a very interesting historical curiosity.
Yeah.
It could have been spontaneous. There's no way to prove something like that.
Yeah, referring to that Hoffman prepared many different derivatives of lysergic acid, and you also prepared the other ones. The well-known are the LSZ and the prodrug 1P LSD that now we can find on the street.
Yeah.
But
we made probably a library of about 30.
Yeah.
We made ethyl trifluoroethyl, and we made some earlier ones of piperidil and perolidil and dimethylperolidil. We made a whole bunch of them. And in terms of, and mostly we tested them in rats, in behavior in rats. And none of them really were as active as LSD. There was one, the secondary butylamide, which looked as potent as LSD, but in humans turned out not to be active. So he made a lot of them, and really, as far as I could tell, and with the work we did, the diethylamide is unique. That diethyl group, as we showed when we made the LSZ, we locked that diethyl group into a dimethylzetidine, a rigid four-membered ring, and showed that of the 3 isomers, the 2 trans and the cis, that only that SS trans was like LSD. So, and then when we published the crystal structure in the 2B receptor and then in the 2A receptor, we actually superimposed that SS, which we published in 2002. We superimposed it on the structure of LSD in the 5-HT2B receptor, and it fits perfectly. It's just so you can see. So we predicted beforehand, but none of the others. You know, if you look at the RR-LSD basically, or the cis, they're not as active. So that space where the di-ethyl group fits within the receptor is very sterically constrained. And once LSD gets in there, we showed that that loop in the receptor, extracellular loop 2, it folds over the LSD and locks it in there. So that's part of the reason why LSD has such high potency and long duration of effect. So, I mean, it's, you know,
We can say that LSD is very unique compound, that
yes,
it was
yep,
the first one of the series, but it's the most unique.
yeah,
Yeah.
it's definitely, and you know, there's, I mean, there's no way he could have known. I mean, he was trying to, you know, there was this respiratory stimulant called choramine, which is this nicotinamide, diethyl nicotinamide, and they were using that as a respiratory stimulant. And so I think his idea was, if you put the diethylamide on lysergic acid, because of the high potency of those ergot lysergic acid derivatives, because of their high potency, with the diethylamide, he'd get a very powerful respiratory stimulant. He didn't know he would get a powerful consciousness modifier.
So in 1953, it was detected serotonin in the mammalian brain. In the following year, Woolley and Shaw proposed that the mental disturbance of LSD were caused by an interference with serotonin in the brain. Until then, there was no clue that serotonin could have a role in brain function. Can we state that LSD was central in launching modern neuroscience?
It certainly was a major player. You know, in the 1940s, there was, with respect to schizophrenia, even up into the 50s, the idea was broadly accepted in psychiatry that it was a failure of the parents, especially a failure of the mother to nurture. And so if your child had schizophrenia, it was the mother's fault. There was no they really didn't understand brain chemistry at all. I don't know what they thought the brain did. You know, I mean, you know, they knew it had neurochemistry in there, but, and so, when it was isolated from the, detected in the brain by Betty Twarog, was a postdoc in Irwin Page's lab at the Cleveland Clinic. And she had developed an assay, I think maybe for a PhD, using this edible muscle called a quahog. And there's a contractile muscle that contracts when you put serotonin on it. And so she had developed that, and it's a very sensitive assay. You dissect this muscle out and hang it up in a little organ bath with the artificial cerebrospinal fluid around it. And then if you inject serotonin, it contracts, and you can measure the strength of that contraction. And so if you add more, it contracts more. And so you can add a little, keep adding little increments, and it keeps contracting and contracting and contracting until it gets to the maximal contraction. So you can take that and you can actually calibrate how much serotonin it takes to contract that tissue to a certain extent. So she was taking tissues out of all kinds of animals and mammalian tissues and analyzing them, doing an extraction, squirting it into this bath to see if it could contract this muscle. So she wanted to look at the brain. So in 1952, when she was doing this work, she went to Irwin Page and she wanted to analyze cow brain. And he just sort of made a joke, because he said, everybody knows that all the serotonin is in the periphery. 80% is in the gut, in the enterochromaffin cells, and it's also in the platelets. In fact, the way that Rapport isolated serotonin was by taking something like 10,000 liters of clotted cow blood, spinning it down batch by batch, and then extracting and getting the serotonin out, which was isolated and then synthesized ultimately at Abbott Laboratories, which made it available. But so when that discovery was found, so Sandoz had been sending LSD out since 1948 or 49. They've been sending it out, and everyone knew it produced this model psychosis, or that was the theory. So LSD produced this model psychosis, psychotomimetic. So then when serotonin was detected in the brain, if you put the structure of serotonin next to the structure of LSD, you can see that they both have this tryptamine fragment. So then as you correctly point out, Woolley and Shaw came out with the first hypothesis that maybe LSD was effective because it was blocking serotonin. That was revised about a year later to suggest maybe it was mimicking serotonin. But that was in 1953, 54. So chlorpromazine was introduced about the same time. And then we had the monoamine oxidase inhibitors as antidepressants. So you had chlorpromazine as an antipsychotic for treating schizophrenia. You had LSD, which produced these effects by modulating some of the serotonin. Then you had MAO inhibitors, and then you eventually had the tricyclics. So I wouldn't say LSD was the sole reason, but without the discovery of LSD and the connection to serotonin, I think serotonin neurochemistry would have been much later being developed than it actually was. So it was a key player. And of course, it generated a lot of interest among psychiatrists, so it got them interested in what's happening in the brain. So it's hard to pull out how much of a contribution, but I believe it was a major contribution to our understanding in biological psychiatry.
Thank you. Although the media always made a lot of drama around LSD, experts, you included, consider it a very safe compound. In the 2018 paper, Is LSD Toxic?, done by you and Charles Grob, the toxicity of LSD is reviewed. Although there are reports of deaths after consumption of LSD before carrying out dangerous activities or just driving, there are no reports of healthy individuals dying from physiological intoxication with LSD. Actually, there is an impressive report of 1974 where 8 individuals snorted LSD thinking it was cocaine, a massive dose, probably dozens of times a common dose. They entered in coma and had a severe intoxication, but after hospital treatment, they all survived without residual effects. Why LSD is perceived one of the worst drugs that exists, but there is no evidence that it's toxic?
Well, it starts with the drug war, right? What we know now is John Ehrlichman, who was one of President Richard Nixon's assistants, has actually said in an interview that we knew the drugs weren't dangerous, but all these hippies were taking drugs and they were protesting the Vietnam War. And that's what we hated. We thought was anti-American, not patriotic. And we couldn't do anything about it, but we thought if we could make the drugs illegal, then we could arrest them for using the drugs. And then once they're arrested for using the drugs, they would lose their right to vote. And so in the United States, right, even now, if you're convicted of a felony, you lose your right to vote. Not some states are changing that, but anyway, so that was the beginning. And so then you had the media hype. You had these crazy stories of people. Art Linkletter's daughter was a famous one. She was severely depressed. She had experimented apparently with LSD, but I don't think it had anything to do with her depression. And she jumped out of a window and killed herself. Oh my God, if you take LSD, you'll jump out of a window and kill yourself. And then in the early years also, there was a paper that came out, and it was incorrectly, poorly done, that said that LSD damages the chromosomes. So then everybody says, all the women say, well, I don't want to take LSD because it might damage my baby, right? Well, that was disproved, but the paper that disproved it didn't get as much press coverage as the paper that first reported it. So you had the media contributed to a lot of that. And of course, LSD is a very powerful drug. And say, oh, 10th of a milligram, very powerful, make you crazy. And you saw all these crazy stories come out about people say, is it true that LSD liquefies your spinal cord? And I said, no, like, where does this stuff come from? So there was a study done that estimated that something like 30 million people in the United States had taken LSD, 30 million, and none had died as a direct result. I wrote that paper on LSD toxicity because there was an individual who was at a music festival in Mississippi, and he took a dose of LSD and he died, and the post-mortem and the autopsy showed that he did not have high concentrations of LSD in his blood. He just had a bad trip. And the police, of course, seeing this guy wandering around the street acting crazy, they handcuffed him. They sicked a dog on him who tore into his hand. Then they tased him. And then they handcuffed him with his hands behind his back, cuffed his ankles, and hooked his ankles with his wrist in what's called a hog tie position. That's known in police circles as the position of maximal restraint. It's illegal in Canada, and in many states in the United States, it's illegal because they know it can kill you. When you're in that position of maximal restraint, you can't breathe properly. And if you get excited or you get agitated, you try to breathe, you die of suffocation. So they left him on the ground, hogtied for like 2 hours before they sent him to a hospital, and he died in the hospital. He was a young guy, a young engineer, had a wife and a little baby. And so the police, the autopsy report said he died of the toxic effects of LSD. So I was asked to opine on that. I wrote a report. The court trial has been postponed and postponed and postponed. I think the police are postponing it. But they asked me, what killed this guy? And I said, well, the police killed him. Had he not had an encounter with the police, he would still be alive. And they said, but what about, he had this asphyxia, he was excited, delirium, and all that. I said, he had a bad experience. It's very traumatic. If you've ever seen anybody having a bad trip, you don't know what's going through their mind. They said, well, why would he not listen to police instructions just because he was taking LSD? Because he was out of touch with reality. He was paranoid. He was hallucinating. They should have handcuffed him and taken him to the hospital right away. Instead of, they hogtied him, put him on the ground, and left him there. And he died from positional asphyxia. And now we've got this trial over here now with George Floyd, where the policeman put his neck on George Floyd, his knee on his neck. It's the same thing now. Every one of those experts who says he died of asphyxiation. You die that way. He had his hands behind him cuffed, people kneeling on him. It's just like the position of maximal restraint. So people can do that. They can do things like think they can fly when they take LSD and jump off of a cliff. That actually happened with the case in California with mescaline. Someone thought they could fly and just dove off of a cliff thinking they could fly. You need, if you take a psychedelic, you need somebody with you who is not taking the psychedelic to make sure you don't injure yourself or injure someone else. But as far as the direct effects, I haven't seen anything. Now there's a recent case, and I haven't really examined it, of someone who apparently took a reasonable dose of LSD and died. And I haven't seen the autopsy reports. I don't know what else they might have had on board. But even if one person out of 30 million dies, that's a pretty safe drug.
Yeah. In the 60s, there was safety protocols for group therapy that I believe they were using like 5 milligrams of LSD for each dose. And
5 milligrams?
5 milligrams. Yeah.
Well, I can't even imagine that.
Yeah, and I can share with you. I think it was related with Timothy Leary group in Millbrook.
I don't. With 5 milligrams of LSD, you couldn't interact with the group.
No. It's they saturate just the experience.
Well, the Rolling Stones song 2,000 Light Years from Home was supposed to be about the effects of 2,000 micrograms of LSD. So I don't know. 5 milligrams is I can't comprehend what that would do.
So drugs were always a political weapon. The prohibition of drugs were used for social control. First the hippies, the anti-war and the civil rights movement, and now the low-income vulnerable classes, especially the people of color. In the recent case of killing of George Floyd that you were talking about, we see the defense, Derek Chauvin, arguing that George Floyd died of his drug use. And we all see the video, 8 minutes of pure terror. Carl Hart, the professor from Columbia University, recently wrote a paper in Neuron, a scientific journal from Cell Press, named Exaggerating Harmful Drug Effects on Brain is Killing Black People. where he argues that drugs have been used to dehumanize people that use drugs. He points the finger to the National Institute of Drug Abuse, but also to researchers and scientists, where he includes himself, that are guilty when they exacerbate drug effects for making of getting grants or publish another paper. In psychedelics, we have also seen the well-known case of Ricard that had a paper on MDMA toxicity retract after it was found that he was using methamphetamine in the experiments. Having more than 40 years working in the field of psychoactive drugs, how do you see the use of drugs as a tool for social, political, and also scientific manipulation?
Well, as I mentioned earlier, the drug war itself
Yeah.
was an attempt to suppress people who were anti-war and were voting against the policies of the Nixon administration. Some years ago, I testified on a committee that was going to set the penalties for possession of MDMA, and they wanted to set it as equal to the penalty for possession of cocaine. We had to testify that no, these are not the same. They're not used in the same way. MDMA is not addictive, cocaine is. And in fact, even with respect to cocaine, you had controversy over the punishment for being caught with crack cocaine versus cocaine hydrochloride powder, because the Black community was primarily using crack, which is the freebase, because it's much faster and more powerful. And the rich white folks were using powdered cocaine hydrochloride. And so what they did is elevated the penalties for crack cocaine, which predominantly
social
affected,
control. Yeah.
which predominantly affected Black people. So now we have, the largest incarcerated population in the world based on population. Many of those are for non-violent drug offenses, marijuana especially, which it's a travesty anybody's locked up for marijuana. But so the government has been used it for social control. With respect to marijuana, which there was never any real basis for it being illegal. It started with the Marijuana Tax Act in 1937 with Harry Anslinger, and that was completely bogus. There was no reason for it, and yet even today you see politicians saying, "Oh no, we can't legalize marijuana; it's too dangerous," because they're just out of touch with. But look at all the young people whose lives have been ruined by who are smoked marijuana and then who are arrested and thrown in jail. I mean, there's just no basis for it. It's not addictive, it's not toxic. It's basically the government trying to control. And marijuana was never really a concern as long as Black musicians and Mexican laborers were using it. They'd catch those people if they spend any time, nobody worried about it. It was only when middle-class white American kids started using marijuana that, oh my God, what's going on here? It really precipitated, a lot of frenzy. So no, I mean, these drugs, the drug laws have been used to control various elements, especially minorities in the population.
Some of the cases, they are not minorities. Like the Black people of color in the US are not minorities.
Well, they are still minority.
You get
but
different groups.
it's a substantial part of the population.
Yeah. So I remember you saying that when you were young, you already were a guru for your friends. You giving harm reduction information about drugs, effects, and doses. How you got interested in psychoactive drugs?
So, well, my friends in high school, I was a science geek in high school. I made explosives and pyrotechnics and things that blew up and tear gas and stink bombs and stuff like that. So my friends all went off to college. I graduated from high school in 1962. They all went off to college. My parents didn't have enough money, so I lived at home and commuted to the University of Cincinnati every day. But they went down to, most of them went to University of Kentucky, which was about a 1-hour drive from where I lived. So they would drive up frequently on the weekends because we were friends, and they would tell me what's happening, etc. They said they were talking about using bennies and smoking reefer. I said, reefer, bennies, because I was pretty naive. And bennies are just amphetamines. So they, all the college students were using amphetamines to study. And then they were smoking reefer, which is marijuana. And I said, oh my God, you guys are going to become addicted. Like, what are you doing? Are you crazy? So then I got this book, and I don't know if it's in here. It's in my other bookcase, but it was Solman's Manual of Pharmacology, published like in the 1940s. I bought it at a used bookstore. And so I read all about marijuana, and it said it's not dangerous. The Guardia Commission had said it wasn't dangerous. And so I started thinking, all this stuff I've been reading in the newspapers is incorrect. So then I started reading a lot more information about these kinds of drugs. And so I became a kind of local expert and say, well, what have you heard about this? And what about that? And what are the doses of this? So I was kind of like their expert. I suppose I was doing harm reduction. I was keeping them from doing dangerous things, but yeah, that's how I got kind of interested in it. And then it was just, with the psychedelics, it was like, how do they work? I mean, somebody can take, how is it somebody can take a small dose of LSD, a minuscule dose, it diffuses into the brain, it stays for some number of hours, diffuses back out of the brain. And those people are sometimes never see the world in the same way, mostly for better, but sometimes for worse. How is a small molecule, how can it do that? How is it possible that in our complex physiology that a small molecule can get in there and just change things like that? So that became a really interesting question for me is, what's this receptor? Where is it? Trying to understand it better.
Very interesting. So mescaline is a very simple molecule. You worked for many years alongside Alexander Shulgin, modifying its structure and creating new compounds, using the principles of medicinal chemistry to design and synthesize new molecules. Can we say that Shulgin was more interested in the subjective effects and creating tools for understand the mind, and that you were more focused on designing probes to study brain function?
Yeah, people have called Sasha Shulgin a scientist. And at least in one instance, I think even in the movie we did, Dirty Pictures, I said, he's not a scientist, he's really an alchemist. So Sasha would he would look at a molecule and say, how can we change it? Okay, let's change it and see what it does to its effects. And so it was really just making whatever he could make easily. And then when Peyton Jacob started working with him, they started doing more complex chemistry because Peyton had a new PhD. Sasha's PhD was in natural products biochemistry. So it was like older kind of technology. So Peyton Jacob he got his PhD actually at Purdue. I knew that he worked with Herb Brown. And then when he went out there and started working with Sasha, he introduced a lot of new chemistry techniques that Sasha hadn't been using. So it was really, what can we make? Like if you look at the simple phenethylamines, you can put an alkyl group in the pair position, but what if you put a selenium there? Like, well, I have no clue. So he made the selenium derivative and then would test it. So he was really making things and then just seeing, I called it actually musical methyl. That was my term for what he did, is moving methyl groups around and then seeing what they did. And then because to get funded as an academic, you have to have a testable hypothesis. So I would say, here's a structure and it has this feature, this feature, this feature. Which of these are important and why are they important? So then we would modify them or we change the shape, we would do things to try to focus in on what was the receptor looking for that this molecule triggered it. So it was really structure activity work. And I was funded by NIDA for 29 years to do those kinds of studies to understand the chemistry of the interaction between the drug and the receptor. And then we started doing receptor work as well. So it was I had to do that to get money. You couldn't do what Sasha did in an academic situation. Sure. They just wouldn't have funded you. He basically would have said, just give me money to make anything I can think of. And you can't get funded that way. So yeah, it was a different approach.
Different approach, yeah. And the chemistry of the compounds that Alexander Shulgin made, it's not too much complicated. I think the amazing thing that he did, it was this protocol that he used with Python and Shulgin and with all the research group that I believe you were also part of it, where he bioassayed all of these new compounds. I think the amazing thing was the systematic testing in humans of these compounds.
Yeah, you couldn't get approval to do that nowadays, but that was a thing, and I actually encouraged him to publish his methods, which ultimately he did, because I said,
In 86, there is the
how
protocol.
I test my molecules, yeah, because I said, no one knows how you do this, and your descriptions are just not that good. Put it in there so people know.
Yeah.
No, so, and his work was valuable because it gave us standards. You know, when we did our pharmacology was all with rats and mice, and early on a little bit with cats. We didn't, I mean, without the correlation, if we looked at a rat model and was inactive, well, does that mean it was inactive in humans? So he gave us human activity data, which we could then use for correlation, and that allowed us to build conclusions about the work we were doing. Because okay, if this compound's active but this one is not, and then we could measure its activity at the receptor, then we could say, okay, you need this kind of activity at the receptor in order to get human activity. So his work was essential to do that. Yeah, so he started at low doses, and I wasn't actually part of his group, but I sent him many compounds we made. So there are compounds in there that we first made, and then I sent samples to him just as like reference samples, and then he would make more. He would follow our procedure. And for example, he never, as far as I know, he never made LSD, but it's written up in TCAL, a procedure for making that procedure, the procedure we used to make LSD. Because he had an analytical lab license, he didn't have a researcher's license. And a lot of people don't understand that, you know, his lab was raided, and they said, you know, what was he doing wrong? He had an analytical laboratory license. And the way that's supposed to work is that the police make a seizure, they give it to the analytical lab determines what it is, and it informs the police. And there's a very specific record keeping. There's a chain of custody. So if the police give it to you, there's a chain of custody. You know how this works with drug samples. And then, so he had an analytical lab license that allowed him to do that, but he didn't have a researcher's license to make controlled substances. So when the police finally came into his lab, he had a whole drawer full of samples, and they'd pull one up and say, what's this? He'd say, I don't know. Who sent it to you? I don't know. And then he would analyze it, would be some controlled substance. So he had a whole bunch of those samples where he said, I don't know who sent it, I don't know what it is. And that, of course, violates the analytical laboratory license. So you have to have a chain of custody. You have to know what it was, where it came from. And then when you get rid of it, you have document the destruction and with a witness and all. And he wasn't following any of those regulations. And so that's actually what they got him for. It wasn't the fact that he was doing research. So, but he quit making compounds. A lot of the things he was making then, you know, if he made them and they were going to go into humans, if they were analogs of controlled substances, and if they were designed to go into humans, which is sort of what he was doing, all of the new molecules he was making that were based on older molecules were all kind of controlled substance analogs. So he pretty much shut his lab down and sort of focused on writing books, the Shulgin Index and TCAL, started doing things like that, which it's excellent to have those. I mean, you know, I have 2 copies of PCAL and 2 copies of TCAL, and anybody who goes in the field, I mean, it's fascinating reading. But it tells how to make them all.
So in 78, you and Shulgin published the first paper on the pharmacological action of MDMA. And years later, you published a very interesting paper stressing that methylenedioxy compounds belong to a different pharmacological class that you name entactogens. Recently, FDA considered MDMA-assisted therapy a breakthrough therapy. Why MDMA is so special?
So MDMA is not a classical psychedelic. It doesn't work the same way. The classical psychedelics activate the serotonin 2A receptor. But MDMA is a pseudo substrate for the serotonin, dopamine, and norepinephrine transporters. It's actually taken up by these protein transporters that normally clear a transmitter from the synapse. It's taken into the neuron, it gets into the vesicles, and it causes the release of the stored transmitter from the neuron. So it works like amphetamine or methamphetamine. They predominantly have an effect on dopamine and norepinephrine, But when you switch over and look at MDMA, the major effect seems to be on serotonin, but they also affect norepinephrine and dopamine. So it's a different mechanism of action. And of course, the fact that MDMA now has got breakthrough therapy is really a tribute to the personal devotion of Rick Doblin. Rick Doblin took MDMA early on and was convinced that it was really an important drug. And so he spent really his life, even his PhD was how to make MDMA into a drug, you know. So he's really focused on that. And, you know, fortunately, it turns out the drug is not addictive and it's not particularly toxic unless you take too much and it's in a hot place and you get overheated and dehydrated. But so the safety worked in his favor. I don't think he could have known that in the beginning. If it had turned out to be toxic, if what George Riccardi had published with his flawed methamphetamine paper, if that had actually been MDMA, it wouldn't be a focus right now. But it's unique. It does have this ability to separate the memory of an event from the traumatic affect. So if you were attacked, or if you were a woman, you were raped, or if you were in war and you saw your best friend blown to pieces, those are really serious traumas. And it keeps coming back in kind of flashbacks. They can't sleep. It's still, so somehow, and this is just luck, I guess, somehow the MDMA breaks that connection between the memory and the affective component that brings out the fear. So you can remember that happened, but you don't have to relive it and feel it in a certain way. That's what makes that one unique. And we don't know of any other drugs that really are quite like that, at least that are studied well enough to know for sure that they're like that. So that's why I call them entactogens. Ralph Metzen was calling them empathogens. I said, I don't like that word empathogen. It sounds like pathogen too much, like they're bad stuff. And plus you don't need them to produce empathy, because if you're talking about a therapist, it's the therapist that needs to have empathy for the patient, not the other way around. But you give the MDMA to the patient. So why does the patient need to feel any empathy, right? So I said, what are they doing? I thought, well, they're allowing you to get stuff that's inside and get it out and talk about it. So something inside, so en, and they're touching you somehow inside. So the Latin root tactus was touching, and gen is to produce. So produce a touching within. So it was the best I could come up with. And just to say, let's set them off as a separate class, because at the time I did that, the DEA was calling MDMA just another psychedelic amphetamine. And I said, it's not just another psychedelic. It's a different mechanism of action. It works in a different way. It should have its own name. And every once in a while I check the literature, and entactogen you still see a few people referring to MDMA as an empathogen, but mostly the terminology is going forward.
Yeah. So in the 80s, you prepared the MDMA for the MAP studies and also the DMT for Rick Strassman study. I remember seeing a photo of you with an Erlenmeyer with, I think it was alpha kilo of MDMA.
Yeah, a 4-liter Erlenmeyer, and I was smiling and digging out the.
Yeah. And that was. You did that work at Purdue. How could you maintain the GMP conditions in a?
You didn't need GMP. You need GMP for your phase 3 trials at that time, but you could do phase 1 and 2 with just a GLP, pure material that wasn't GMP. Now they apparently always had the regulation that it needed to be GMP for phase 1, but they weren't enforcing it. So when when Rick Doblin, he had checked to see, and he couldn't find anybody who would make MDMA for a reasonable price. And I had met him at Esalen, and he contacted me and he said, could you make MDMA? And I said, yeah, it's a simple synthesis. I've never done it before. But he says, well, if I put you in touch with the FDA chemist, they can tell you, could you do it? I said, sure. What would you charge? I said, just the cost of starting materials. We'll just do it, the graduate students and I'll do it as a benefit. And so the FDA chemist told me, okay, we need your CV, we need this physical description of the facilities, how you clean them. We need to know where you got all the intermediates. We need the batch numbers from all the intermediates. We need a quality assurance all the way. We need an analysis of all the intermediates and all. It was pretty much like just a standard thing, except we made, I think, 2 kilograms, and charged him $4,000 for the starting materials. And I was at a meeting, and Rick told me, yeah, he just got a kilo of GMP MDMA. It cost him $400,000.
Yeah.
So I was at this meeting in Prague, and I told the audience, it was a wrap up at the end. I said, you're all really lucky to be here, because I said, I was just talking to Rick, and I said he wanted some pure MDMA to use for his early studies, and so we made him 2 kilos for $4,000. And I said he was just telling me he paid $400,000 for a kilo of GMP. I said if he had been forced to do that way back when in 1986, none of this would be happening, because nobody had that kind of money.
Yeah.
So I said, you're all lucky to be here because we did that. And then I knew Strassman. I'd also met him at Esalen, and he was bemoaning the fact that nobody was doing clinical studies. And I said, Rick, you're an MD, you're a psychiatrist, you're in the medical school. You could do this if you want to do it. And he said, you think so? And I said, sure, So he said, well, what if I go through all the hoops and everything? And he's written about this. What if I go through all the hoops and I get to the end and I get the approvals and then I can't get the DMT? And I said, well, I just made 2 kilos of MDMA for Rick Dobbin. I'll make the DMT for you. So that's what happened. He got all the approvals, wrote the protocol, got everything done, and said, nobody's going to make the DMT. So then we made the DMT. And so then, and I had met Roland Griffiths. He was a member of the American College of Neuropsychopharmacology. And I had seen him at various meetings. We talked about stuff. So he got ready to do his study that he published in 2006 and said, can you make psilocybin for me? We actually had been trying to make psilocybin for Strassman because that was the next thing he wanted to do. But my technician, Stuart Festus, the reagent that Sandoz used to make psilocybin in the beginning, that was called a dibenzyl phosphorochloride. And
very unstable and
you can't buy it. And if it's a neat liquid, it can spontaneously detonate. So Stuart was reading about this reagent. He said, I'm not going to do this. I said, yeah, no, we're not doing it. See if we can find another way to do it. So then he hit upon, and actually was in, I think, the early Sandoz patent, tetrabenzyl pyrophosphate. So we made 4 grams, I think, for Roland initially for that early study. And then we tweaked it, and the Japanese workers came out and they found an improvement to the procedure. We hadn't been aware that there was an intramolecular transfer of a benzyl group from an oxygen to a nitrogen. We hadn't realized that because my technician hadn't run an NMR, unfortunately. So then when I saw that, then I thought, okay, well, now we can do it. So then we made 20 grams for Roland, and that's most of the material they use for a lot of their studies with psilocybin at Johns Hopkins. And now, of course, you can get it GMP. There's a couple places that are making it. But yeah, so
yeah, but based on that synthetic route, Zona Institute now made a scale up of the method, and how do you see the I think this shows the importance of psychedelic chemists in the psychedelic renaissance. Without the cooker, there is no cake. So
yeah.
how do you see the future of the psychedelic chemists in the psychedelic future, or future psychedelic medicines?
I think if you look at like compass pathways, USONA has Compass has a research group now that's supposedly looking at new molecules. USONA has chemists that they've hired now looking at new molecules. There's another place in Canada called Viagens that's making GMP psychedelics. They'll be probably looking at new molecules. So I think like any pharmaceutical industry, once you find something that works, then you turn it over to your chemist and say, make me 500 analogs and we'll test them and see whether any of them have, useful properties. Right now we have what? We have 3 chemotypes: mescaline, phenethylamine type things. We have tryptamines and ergolines. I don't think the ergolines are going to be very productive. Possibly FLAD, the N-ethyl and the allele, they are interesting. Nobody has done clinical study with those, but they're long acting too, like LSD. So the drive really is to go to short acting things. A lot of people are interested in 5-methoxy DMT because it's so short acting. when you think about the economics of doing therapeutics with these, you know, if you have two co-therapists with a physician on call and somebody's in a rented clinical facility for 6 to 8 hours, that's pretty expensive.
Mhm.
So they're all trying to find out, do we need so much preparative therapy? How much integrative therapy do we need afterward? Can we shorten the duration from 4 to 6 hours? Can we shorten it down to, say, 1 hour or 2 hours? Well, that's one thing, you know, there are a lot of ketamine clinics now. Ketamine is fairly short acting. So there's a push now, find short acting things that still work. So the field is going to develop like any field, I guess. I got an email from someone who had a list of 600 entities that are now trying to make money in the psychedelic drug space. 600. And there's not sustainability for 600. The players that know what they're doing and can get investors, they'll keep growing. And these people that have this idea of starting a company to make psychedelics, they'll realize it's a lot more expensive and a lot more difficult than they had thought, and they'll fall by the wayside. And so you'll see an attrition, and you'll end up with probably 3, 4, maybe 5 companies that are being successful. And then I can't predict farther than that, really.
So one of your last works was on N-benzyl phenethylamine derivatives, or N-bombs. I've been working with N-bomb derivatives in the past couple of years, and it's quite amazing how adding a methoxybenzyl group to the amine can increase many times the potency when compared with the primary amines. However, it's quite scary how many deaths are being related with unintentional consumption. There are many reports linking the severe intoxication and death to the consumption of N-bombs. I'm quite interested in this toxicity mechanism. Reading the case reports of poison centers, I see that it's not uncommon to see 2 people that took the same dose. One has a nice psychedelic trip and the other has a severe intoxication. Do you have any information why this could happen?
So from the crystal structure of the N-bomb that we published last year, it wedges itself into the receptor, that N-benzyl, and that orthomethoxy is a hydrogen bond acceptor for serine that's in helix 3. And the benzyl pushes against tryptophan 336 and pushes it down, and that's what actually activates the receptor. And so it has high affinity. It's a potent activator of the receptor. What I think happens is that in the people who have a normal experience and survive it, it's known now from Christensen's work, Jesper Christensen's work in Denmark, that the 5-methoxy group is demethylated very rapidly. So the enzymes, the P450s that are in the gut, they're surrounded essentially by lipids. So the things that get in there to be metabolized are very fat soluble. So the N-benzyl compounds are very fat soluble. So in the first pass after you take them orally, they immediately get broken down by O-demethylation. And of course, we know they're not active orally in most people because they're broken down. So what they do is they put them under their tongue and it's buccal absorption, whatever. What I think happens is that there is a subset of people who don't have sufficient activity. They're slow metabolizers, and they don't clip off that 5-methoxy. And so the intact molecule is in their body. It gets in the receptor, it stays there. And for some reason, a prolonged potent activation of 5-HT2A receptors leads to the death. And I don't know exactly whether it's serotonin syndrome, seizures, hyperthermia. I'm not sure what happens in those deaths. But I think that
there's no information regarding to this. It's still something to.
I think for most people, though, they metabolize that 5-methoxy off, and it's rapidly conjugated, glucuronidated. So I think for people that are normal metabolizers, it's destroyed by metabolic enzymes. And the people that die, I think, is a subset of people who don't have the P450 to do that O-demethylation. So the intact molecules in their body long enough. So that's kind of the underlying mechanism. That's the way I think it's happening. But why having the intact molecule there in your body, why it's potentially fatal, and that's not clear to me.
Yeah. Yeah. For us, it is very, very scary because in our drug checking service, we punctually detect the N bombs being sold as LSD, and actually that there in 2017 we published a paper where from 200 samples that we analyzed, 10% was N bomb derivatives. So it's very and having in mind what we discussed earlier, that the safety profile of LSD, and now we have this new compound that it's potential more toxic than LSD. Uh, I don't understand why policymakers don't see this, how the drug war is doing more harm than good.
Well, it's I don't understand either. It's the same situation with cannabis and all these synthetic
Yeah,
cannabimetics. I testified at a committee in Washington in front of the House committee where they wanted to make everything illegal. And I said, you have to leave an avenue for scientists to be able to study these when they come out. They just didn't understand. They thought, well, we can make everything illegal and then scientists will get permission and they'll study them. But I said, it doesn't work that way. Once you make it Schedule 1, a controlled substance, you're going to really shut down research because you have to have a special safe, you have to have, rationale, you have a protocol they have to approve. I mean, it's not very simple. And so the guy next to me said, my son, his son had died. He said, and my son was using marijuana and we were really upset. So we got him into a rehab program to get him to stop using marijuana. Right. So you know where this is going to go. And he said, and so then after he recovered from this marijuana addiction, basically, he went to a party with a friend and they had some spice there. And he said, oh, it's legal marijuana.
yeah,
So he said he took one puff and went into a coma and died a week later. Well, that's not what happened. But those spice mixtures have killed people. They're not, they are toxic. And I'm sitting there thinking, if marijuana was legal, your son would still be alive. So, and I actually, a student of mine, Andy Hoffman, I think he was the first one to say this. He said, make one drug illegal and a more dangerous one will take its place.
yeah.
And that, I think, is a truism. Make something illegal and more dangerous drugs take their place. And you would think that regulators would see that. Say, we were better off letting people smoke marijuana than having, but they just think, if they want to do it, they're going to break the law. I mean, it's their responsibility, but it doesn't express concern for human users.
Yeah, and we have already 50 years of war on drugs, and we have a lot of data on this, and I cannot understand why this happened. So two questions to finish. So a lot of people are talking about microdosing and the practice of taking low doses of psychedelics. In the case of LSD, it will be like 10 or 20 micrograms to improve cognition and creativity. However, a recent self-blinded study from Backlund Foundation showed that there is no difference between the placebo and the microdosing. However, there are some risks that are not being considered, especially for the heart, cardiac toxicity. In your opinion, what are the risks of taking psychedelics every day or almost every day, even if in low doses?
Well, the problem with LSD especially is it gets trapped in the receptor. And so even if you take 10 micrograms, it may still accumulate in the receptor, but the receptor that's problematic is the serotonin 5-HT2B receptor, which stimulates connective tissue in the heart and lungs. So it leads to valvulopathy, cardiac valvulopathy. So I don't know, 10 micrograms. The thing is that if you looked at Fadiman's protocol for microdosing, it's like every third day, something like that. But people are not doing that. They're just saying, oh, I take 10 micrograms every day or whatever. It makes me feel good. I think there's a risk in some of these people with long-term use, that they will start showing cardiac valvulopathies. And that's the big danger there. There's been no study that actually shows that microdosing works, as far as I know. But most of the studies have been with healthy people. Now, I don't know if you took someone who was severely depressed, if you gave them 10 micrograms of LSD, say every day or every other day, would that have an effect? That hasn't been done. All the studies that I've seen have been with healthy people. And so it's the idea in that study you refer to is that the placebo is just as effective as the drug, because if they believe they were getting the real drug, or they thought it was, oh yeah, what's making me feel better? So I'm not convinced it's really a good idea. And I'm not sure it really works. And so if someone is taking a low dose of LSD every day, I would be concerned about effects on the heart.
Yeah. So to finish, now we are living in challenging times, not only in public health, but also with mental health. Do you think psychedelics will have a role in the new psychiatric treatments in the post-COVID era, if there will be a post-COVID?
Yes. From the studies that have been published so far, psychedelics, I think, are a new paradigm for psychiatry. Psychiatry has been one of the most conservative branches of medicine forever. They haven't had any new drugs. You know, a new SSRI comes out, and then a new SSRI comes out, and they say, oh, it's better than the previous one because it works 2 days faster or something like that. I haven't seen any real new drugs for psychiatry except these psychedelics, and they seem to have profound therapeutic effects for depression, anxiety, addictions. We don't know about OCD, eating disorders. Those trials are all underway now. So it may be that this brain reset mechanism, which seems to happen, actually is going to give psychiatry a new opportunity. When I taught medical students at Purdue, I would often ask, how many of you, what are you going to go into and specialize in? No one ever said psychiatry. They said cardiology, general practice, OBGYN. No one ever said psychiatry. So I asked once, I says, why don't any of you want to go into psychiatry? And he said, you can't heal anybody. There's no effective treatment. So like, why do that? So, and now I've had a couple of people write to me and say they're going to become psychiatrists because they want to use these medicines. So I think it will revolutionize. It's going to still be, 10 years before we really see the impact of it. But, I think with MDMA and PTSD, I think Dalvin is thinking he'll have approval by 2022. And I don't know, maybe psilocybin 2022, 2023. So go 10 years beyond that. I think if we come back 10 years in the future and look at this field, we'll see that there are clinics all over to use these, and it really is going to improve the mental health of Americans and people globally if they're used globally. I think it's a new paradigm, and I've written about that. I think this is the new paradigm for psychiatry. So I'm very optimistic.
So thank you very much, David, for your time and taking your time to support Kosmicare and to spread information about drugs.
Sure, happy to do it. I gave you more than an hour, but that's good.
Thank you.